What a fucking mess. Okay, part 2 of the VA drama. Listen, it's up to veterans to pass these videos around. I avoid the YouTube algorithm, and it avoids me. My page is basically a diatribe against the system. So it's not interesting. I don't do entertainment. I do what I'm doing right now, which is talking to other veterans. So because procedure wasn't followed, there's a giant fucking mess with my opioid prescription. Tomorrow I will be in severe withdrawals. None of this had to happen. I'm changing my doctor. Why? For 20 years, I've listened to him bitch about the VA, how the VA treats him. For 20 years, I've never had a single follow-up consultation for a single test that I've had. Not one. He misdiagnosed me as having hemochromatosis, which put me through very painful blood withdrawals for a year. I've had 2 very extensive heart tests with chemical injection, and then they MRI you before, then they inject you, they run you through this thing, and then they MRI you again. Not a single solitary fucking word from my doctor at the VA about that. Not a single follow-up consultation. Nothing. Completely leaving me in the fucking dark. Okay? The shit growing on my lungs. Basically, MD Imaging here in town said, no, we want to see you again because this is continuing to grow. My doctor, the VA doctor, basically has not asked for another test. You see, I think the VA was trying to avoid, at any fucking cost that they can, to find anything else wrong with me because they'll have to up me to technically 100%. Right now, I'm 70% unemployable. So they give you the check, but they don't give you the rights. You see, my wife would have more rights, etc. So in 20 years, my doctor has failed to basically treat me as an individual patient, which is why I ended up over at the Indian Rancheria Clinic, because my doctors there actually care for me. They care for my health. My doctor over here, his hands are tied by the DEA about how much medicine I can get for my pain, which seems so ridiculous that a federal bureaucrat can tell doctors, here's a blanket thing, this is what you can prescribe, is so ludicrous in its ideal, okay, that every veteran has a different pain level. Some people are worse than me, and I feel so badly for those people, and I know why veterans commit suicide every day. I talked to a pharmacy agent at the VA, and she tells me, oh, well, there's an opioid crisis. And then she tells me, well, this opioid control has been in the DEA hands for many years. And I'm like, well, which is it? Is there an opioid crisis in the VA? Or has the DEA's blanket coverage of what doctors can do solved the opioid crisis at the VA? Well, they solved it by simply cutting the amount doctors can prescribe. They didn't fix anything, which is kind of crazy, right? I mean, this person doesn't know me. They don't know my pain level. They don't know my history of use. They know nothing. And I understand if someone comes in every week because they're short, but in 20 years, that hasn't happened to me. So I'm not that case. I'm not that person, and I should have the gravitas that I've earned over 20 years and not be in pain and withdrawals every fucking day, because you naturally build up a tolerance, which I have, and now I'm in withdrawals every day. The sweating, the fucking, all the other problems that come with withdrawals, okay? So, typical VA doctoring, and I've requested the form to get another doctor. Not that it's going to be better, but it's going to be different. And I will tell that doctor, look, if I have to have another fucking heart test, I expect to have a follow-up consultation to explain to me exactly what it was about, why it was asked for. Why would my doctor ask for that kind of invasive fucking heart examination and then not say a single fucking word to me? Does that make any sense to any of you out there? No, it doesn't. So I feel so sorry. Veterans were treated like shit because we're government property when we're in, and they'll basically give you an Article 15 for getting a sunburn when you're stationed in Las Vegas. You know what I mean? You're a piece of fucking property. You have no constitutional rights. And then when you get out, because they fucked you up permanently for the rest of your life, they actually gave you an injury that you will live with for the rest of your life. No one's going to employ you with that injury because they don't want to be responsible. So you lie, but you can only lie so many times before it catches up to you. And then no one wants to touch you with a 10-foot pole. What does the VA say? Well, here, now we'll give you $44 a month instead. Right? And you wonder why veterans commit suicide? Because they end up mooching on their friends and families, and year after year after year. They can't work. They have no life. They're in pain. They're suffering. And the VA is treating them like a fucking adversarial enemy. That is why. In a nutshell, that's just the absolute truth. The fucking back talk I got from the pharmacy representative from the VA today was fucking ridiculous. She was basically standing up for the DEA. And well, either the DEA has solved the problem since you quote unquote, they've been doing this for a very long time. Well, it obviously hasn't worked other than just cutting the doses. That's not medical care. That's fucking bureaucratic care. So other veterans out there like me are probably in more pain, but every single day, every single night, every single morning, I suffer the symptoms of withdrawal. Some days are more severe than others, depending on high pressure, low pressure in the air, etc. Okay, but it's hard. It's very, very, very hard, and I'm an incredibly fucking lucky man that I have the wife that I have. So there's not much that we can do because we're fighting against the machine. The big, ugly fucking VA machine. It's ineffective. We need national health care is what we need. Like Canada. And get the fucking DEA out of our faces, because if I was at a civilian doctor, he would be prescribing me probably what I was getting in 2016, which was twice the dose that I'm taking now. And the fact that I quit that dose myself of my own volition should prove to anybody that I don't have a fucking drug problem. I quit that dose. The VA didn't make me quit it, and the DEA didn't make me quit it. I quit that fucking dose. And when I couldn't live with the pain any longer, because I mentally needed to know I was feeling this way, because the narcotics they depress you, you know. And I needed to work out, is this worth it? Well, yeah, it's worth it. The pain was so bad, I just couldn't live with it. And when I went back to get my morphine reinstated, I asked for half as much. Now that is not a problem. That is not a person with a drug problem. So now here I am after all these years, close to a decade later, my tolerance level is just up through the fucking ceiling. It doesn't help my pain. It doesn't help my withdrawal symptoms. But the DEA says this is all you can prescribe to my doctors. It just seems so ridiculous that it's this blanket thing. This is what you can do when it's ineffective. Why have someone addicted and be chained to that fucking addiction? Come and do a fucking piss test every fucking 60 days, you know what I mean? This kind of thing, when it's not really helping them. And you wonder why veterans are depressed. For me, it's ludicrous to even consider anything else other than it's the system. Now, if these videos got any fucking traction whatsoever, the people who've been here for a long time have no doubt that I will follow through, that I will be literally pounding on fucking doors at the DEA in my local fucking office to track down and find out this mythical person who gets to regulate pain medication for doctors. Because that's what they're doing. Make no mistake about it. They're not solving any fucking opioid crisis. The opioid crisis was caused by the Sacklers with OxyContin. That's where the opioid crisis, they killed 700,000 Americans. What do? They take some of their billions and just fucking buy their way out of trouble, leaving the devastation behind them. None of them going to fucking jail. Luckily, a judge said, no, we're not going to give you blanket protection and other people can sue you. So maybe I need to sue the Sacklers because they're the ones that created this opioid crisis. See? So if you're a veteran, pass this fucking video around because other veterans are in the same boat I am. They're getting the same kind of half-ass shoddy fucking medical care that I am. Getting a test done does nothing. If you don't understand the test, if you don't understand the results of the test, if you don't know how to understand how to make things better because of the results of the test, et cetera, et cetera, et cetera, okay, why do the fucking test? You're just wasting taxpayer money. If it's not going to do any good, this is what I feel. The last two $60,000 tests that I had done for me, is they're just wasting fucking taxpayer money. If I'm not going to get any useful information or preventative care or anything else. Now, it took my doctor at the Indian clinic to prescribe something to help my chest pains and my kidneys. It took them. The VA, they've had 20 fucking years to do that. Nothing. So this is why I changed my doctor. I don't care who it is. Male, female, I don't care. Okay? I just can no longer mentally put up with a doctor who appears to just come in as quickly as they fucking can, do their 15 minutes worth of fucking typing. And I swear, I mean, from my point of view, he doesn't hear a single goddamn thing I say. I'm just bitching. That's exactly the feeling you get. I'm just fucking bitching. I'm not explaining to him the medical conditions that are driving me up a fucking wall or making my life miserable. Because all he can care about is how the VA is treating him. That's really how I feel. That he doesn't give a flying fuck. Okay? I don't need to mention his name, but there's a lot of patients here in my North State area, I'm sure, that have him. And I'm sure that they're getting the same level of care. Now, they may be happy with it, but I like a little detail. I like a little more in-depth information from my doctor. My doctor. Okay? This isn't my fucking carpet salesman. This is my doctor. So when I have tests and complications and things that never seem to be resolved, this is why I moved over to the Indian clinic and I stopped going to the VA. Pretty much all of my medications come from there now. And had my doctor not deceived and lied to me, all he had to do was tell me one simple fucking thing. When I sat there, I said, look, I need to increase my morphine dose. Can I get one more breakthrough a day? He didn't say a fucking thing. Doing his little fucking writing, and he says, okay, so now you're going to be doing 3 and 2 instead of 2 and 2. Okay, that's exactly what I needed. I find out next that what he really did was cut my fucking morphine dose by 15 milligrams a day, doing some fucking juggling act that was supposed to perform some miracle fucking action by making me take less 3 times a day. It's insane. It's fucking insanity. He lied to me. All he had to do was say, I can't do that. That's it. Just, I can't do that. I would have said, thank you very much. And I would have left and I would still be continuing to get, all my visit to the VA did that day was fuck shit up. Because he didn't even have the balls or the common sense, or he didn't hear a single goddamn thing I said, right? I was there for withdrawal symptoms. That's why I was there. And he decreased my fucking dose. Can you imagine that? Can you imagine any fucking doctor not understanding what I was there for? All he had to simply say was, I can't do that. Okay, thank you very much. See you later. No fucking issues, no problems, no crying wife, no multiple phone calls to the fucking pharmacy, no misfilled out forms, no fucking issues, no problems whatsoever. Okay? And it should have been solved last fucking week. The correction should have been done last week. We've made enough phone calls. Everybody understands the goddamn situation. Should have been fucking fixed. Okay? So I will be showing up at the fucking emergency room tomorrow saying, where's my fucking medication? And they will get goddamn tired of that, I'll guarantee you. Shit will get fixed. So I have a pharmacy agent that right now is trying to help me. She was very nice, very helpful. She understood the situation. Again, her, like the original one I talked to, was appalled at the situation. But the one I talked to today, man, she sounded like a fucking DEA agent. And that I didn't know what I was talking about. And talking about veterans committing suicide was a personal affront to her. That's what it sounded like. Okay. So if you're a veteran, follow this series. I know exactly what I'm talking about. Like my wife, right? She quit a very, very healthy, lucrative fucking job 19 years ago to take care of me every day, my daily needs. Because sometimes I'll be locked in my bed for fucking 2-3 weeks, unable to fucking move, pissing in a container. Okay. She feeds me, clothes me, cleans my clothes, makes my bed. I mean, without her, I'd be fucked. I'd be lost. She's such a wonderful person. I'm so lucky. Okay. But the Veteran Administration pays her $150 a fucking month. Pretty goddamn shameful, isn't it? Huh? So pass this around. Veterans, listen, if there's no other place that we can stick together to do some good other than some goddamn fucking webpage, okay, where nothing ever gets out into the public view, this is the public view here, okay? If this got 1 million views, trust me, there'd be someone from the fucking VA or the DEA or whatever fucking leaving a comment here going, oh, it's not our fault. They'd at least be giving us fucking excuses, okay?